speaker today is Tumi Wallace. Tumi is a senior intelligence analyst focused on Eastern Europe and Central Asia. He studied political science and history, followed by postgraduate law at the University of Cape Town. Tumi has previous experience as a policy analyst in criminal justice for a Texas state senator and as a strategy consultant for the consumer industry and government in Cape Town. Tumi is going to provide an update on the COVID-19 recovery in Eastern Europe and Central Asia. Tumi?
Thank you. And good day, guys. Many of you will now be familiar with the scenario model we created to show how the pandemic is likely to develop in specific countries over the next 60 to 90 days. The general characteristics of each of the four possible scenarios are as shown. In the health first scenario, governments maintain widespread restrictions, but crucially maintain public support. In the incremental normalization scenario, governments roll back restrictions without endangering public health or causing public anger, and again, the public remains largely positive. In the business first scenario, governments roll back health restrictions in a way that causes a negative public health impact and consequently generates negative public sentiment. With the no normalization scenario, significant restrictions remain in place, but the public is not on board, with widespread dissatisfaction manifesting as disobedience to government restrictions, with growing political opposition and some civil unrest. Basically, health first and no normalization are restrictive, and incremental normalization and business first are de-restrictive. To determine a scenario, we monitor around 150 location-specific indicators around things like demographics, medical capacity, the availability of medical equipment, levels of anti-government feeling, economic data, and announcement from stakeholders such as government, union, NGOs, charities, that kind of thing. We benchmark those indicators against four drivers. The key drivers are government action and public sentiment. Medical capacity and the effectiveness of businesses' response both have a bearing on how the government will act, and how on board the public will be. All right, our first case study is Russia. And here we continue to predict that incremental normalization is the most likely trajectory for Russia over the next 60 to 90 days. The likelihoods of each scenario is as shown with these percentages. The figures in brackets are the likelihoods of each scenario when we assessed them back in June. So this gives you an idea as to the country's trajectory over the medium term. Russia's trajectory remains fairly similar to what it was 2 months ago. The chances of continued de-restriction have increased slightly, with the chances of a nationwide snapback of restrictions decreasing slightly. Over the past 2 months, Russia has continued to gradually lift restrictions on movement, travel, and business in line with our previous assessment. Public sentiment regarding the COVID-19 restrictions specifically has remained largely positive. Although there has been discontent in some regions over political issues, general adherence to COVID-19 regulations remains relatively high countrywide. Although Russia has seen some localized spikes in infections as the restrictions were eased, medical capacity was not overwhelmed as we saw at the beginning of the pandemic. Field hospitals and other temporary medical facilities that were constructed to handle the peak of infections have remained online, and are now the places where COVID patients are specifically sent, freeing up the permanent hospitals to see non-COVID patients as per usual. Decreasing infections and spare medical capacity have allowed the government to continue de-restricting. Most industries and businesses have been allowed to resume, provided they implement hygiene, sanitation, and social distancing guidelines. Public transportation operators are increasing services, and international flights resumed August 1st, initially only to a few destinations though. Russia registered the world's first coronavirus vaccine on Tuesday, and authorities want to begin administering it to medical personnel by mid-August and the general public in October. News of the vaccine may encourage residents to travel and gather privately, increasing infection rates over the short term. Infection rates could increase disastrously if the vaccine is both widely administered and ineffective. Russia announced a 60 billion euro stimulus package. It largely contains tax breaks and focuses on future spending, placing emphasis on supporting small and medium-sized businesses, but it also provides a social safety net to those who have been economically impacted by the COVID restrictions. It's a really comprehensive package if Russia can deliver on it, and it may ease some of the negative public sentiment that's been steadily growing over the last few weeks. And we've seen protests in Khabarovsk, which have gone on for the last few weeks, and we've seen protests in Moscow in the wake of the constitutional referendum. They're not necessarily about COVID, but they are taking place in violation of restrictions. The latest stimulus package could also be indicative of a rush to return to economic growth. Oil prices have recovered from the lows of April and May, rising above $40, which significantly boosts the Kremlin's coffers. Some observers believe restrictions are being lifted too quickly and that authorities are willing to risk public health for the benefit of the economy. For this reason, we assess there is a 35% chance the country will lapse into a business-first scenario. Considering the ongoing de-restriction, there is a slightly reduced likelihood that the government will enter a health-first scenario. Nonetheless, the government has demonstrated that they are willing to impose harsh, sweeping measures to curtail the pandemic. Accordingly, highly localized lockdowns or even nationwide measures could be introduced in response to flare-ups in cases. With Russia, we're going to monitor several indicators that could influence the pace of de-restriction. These include medical capacity and case numbers. We'll also be closely monitoring news about the new vaccine, as this could play a large role in the pace of de-restriction. It will also play a large role. The vaccine will also have a big impact on public sentiment towards the government's recovery plan. We're going to monitor announcements regarding major public events. While several protests and public events have taken place in defiance of the restrictions, very few protesters have been denouncing the restrictions themselves. Protests have largely related to domestic political issues, as I mentioned. The fact that people are protesting over their ordinary concerns may itself be an indicator that Russians are beginning to feel comfortable with public activity again, though perhaps prematurely. Our second case study is Kazakhstan, and here we see some significant changes in the likelihood of each scenario. This is largely because the country entered a second hard lockdown July 5th after COVID cases spiked in late June. We now assess that the country is moving towards health first, though decreasing public patience with restrictions means the chance of no normalization remains moderate. In early July, a sharp increase in new COVID-19 infections was noted, and many hospitals were overcrowded due to the influx of patients. Authorities used the second lockdown, which is currently set to expire August 16th, to bring excess medical capacity online. Temporary medical facilities have been set up in most major cities, including Almaty and Nur-Sultan, where there are at least 2 each. As of early August, the rate of infection has slowed significantly, and hospital occupancy has gradually decreased, though it remains high. Over the next 60 to 90 days, we assess that authorities will likely enter a phased recovery, but with a bit more of a cautious approach than they did following the first lockdown. After that lockdown, that first lockdown, was lifted May 11th, public sentiment and compliance with COVID restrictions wavered all through late May and June. Few people wore masks, many small gatherings were held in private and public as the summer began, and perhaps the authorities were a bit too hasty in reopening non-essential businesses and retailers. With the flu season approaching, authorities will likely adopt a much more cautious approach, prioritizing healthcare over the economy in the medium term. Importantly, public compliance with COVID measures has increased massively in recent weeks. Some regions will inevitably experience higher caseloads than others. These regions will be subject to prolonged restrictions. Additionally, authorities will likely reimpose localized measures in response to regional outbreaks. As Kazakhstan moves away from the sweeping lockdown strategy, we'll see more targeted responses to outbreaks in cities and districts. It remains to be seen how much more successful this strategy will be the second time around. Kazakhstan does not have a strong contact tracing program, so an aggressive testing strategy is essential, and it must be focused on residents and key workers rather than travelers. So we can expect authorities to continue restricting international travel for some time. At present, officials will hold individuals entering the country for 2 days for lab testing before releasing them either for hospitalization or self-isolation if they're asymptomatic. The government is typically capable of limiting the effect of negative public sentiment. For this reason, the likelihood of no normalization has remained steady at 30%. Restrictions have remained in place, but public compliance seems to have increased rather than decreased. Nonetheless, authorities are unlikely to be significantly concerned over a short to medium-term backlash around COVID-19 policies. It is possible, however, that negative sentiment could manifest itself in protests denouncing foreign interests, particularly Chinese interests. The prolonged crisis has placed the government under massive economic pressure. However, the previous spike in cases will likely temper the government's desire to reopen the economy too hastily. As a result, the likelihood of the country returning to a business-first scenario has decreased sharply from 50 to 15%. In Kazakhstan, we'll be monitoring the indicators that would determine whether the government is planning on amending restrictions. We'll also monitor indicators that would determine public sentiment. These actions would differentiate between whether the country will continue following a health-first scenario or enter a no-normalization scenario. In particular, we'll be looking for announcements over the reopening of Kazakhstan's international borders, as well as health authority decisions over localized lockdowns and additional local measures that might increase the likelihood of a no-normalization scenario, especially if they're unpopular. In addition, we'll be looking for signs of whether the government is planning to relax nationwide restrictions and move towards a more targeted restrictive regime based on locality, industrial sector, or demographic group. Finally, we'll examine case data. We need strong and reliable case data that indicates the rate of infections is slowing and medical capacity has not been overwhelmed. This would assist the country in combating any resurgence and enable it to move toward incremental normalization. Okay, now moving on to Tajikistan. So Tajikistan was slow to acknowledge COVID-19 in the country. While they have now done so, restrictions remain incredibly light. Nonetheless, these limited movement and business restrictions have had a significant impact on the economy. Additionally, public compliance with behavioral guidelines is much improved. We therefore assess that Tajikistan is likely to maintain its business-first approach over the next 60 to 90 days. While the government did close down some shops, marketplaces, and other retail locations, many non-essential businesses were permitted to continue operating. State-owned enterprises and major industries continue to operate, and there are few signs that anti-COVID measures have been implemented at these facilities. Independent media and local activists continue to report incidents of low-level unrest targeting state officials or in response to government policies, especially in rural towns in the east of the country. Most recently, residents staged small impromptu protests at ATMs after the government announced that some of them would be closed to prevent crowds from gathering. Most demonstrators didn't appear to be wearing masks, and they certainly weren't socially distancing. Elsewhere, state-run bakeries and grocery stores have seen small protests over shortages and high prices. This has continued for a while now. And we can see that despite implementing few business restrictions, Tajikistan's already weak economy is under strain, and this is being transferred to consumers. The strongest driver behind the government's business-first approach is economic. Despite receiving around $190 million in pandemic relief funding from the IMF, the state would likely still struggle to effectively support all those who'd be unable to work under a strict lockdown. This is currently perceived as the greater threat than that posed by COVID-19. Additionally, observers believe the president, his family, and close associates have personal financial interests in keeping large, state-dominated industries going. Finally, the opposition does not pose a credible threat to the government, and as a result, the president feels very little pressure to tighten the lockdown. With Tajikistan, when it comes to the indicators, we have to note that while we're going to monitor them, there would need to be a confluence of a number of very concerning factors to shift the authorities to introduce tighter restrictions. We're going to scrutinize infection rates and hospital occupancy data. There are concerns that this data is very unreliable or easily manipulated by the government. However, we've seen through this pandemic that cases can reach such a crisis level that it becomes very difficult to conceal. Should this occur in Tajikistan, then we may see the government change approach. We will monitor the availability of PPE and ICU beds. Authorities have brought on spare capacity, but it could be easily overwhelmed. The government continues to maintain that hospitals are under capacity, infections are decreasing, and health authorities are capable of dealing with the problem. This could be a false narrative, so we'll carefully monitor activist and health worker chatter as well as official sources. Protest strikes and other civil disobedience against the weak government response could prompt tighter restrictions. This would indicate that the situation has worsened and would force the government to respond to public concerns. But given that the authorities have a history of responding violently to dissent, it would take massive action combined with things like international pressure to convince the authorities to change tack. And Belarus is our final case study. And with Belarus, you're probably aware that there's been a bumpy ride there since Sunday's presidential election. As far as the COVID-19 situation is concerned, the indicators suggest only slight movement in the likely scenarios. As you can see, business first has risen from 75% to 80%. This is a reflection of a seemingly total disregard for the health threat posed by the virus and a clear determination to resist the implementation of any widespread health-based restrictions. This has at the same time led us to lower the chances of a restrictive health-first scenario, which of course is also dependent on positive public sentiment, of which there's very little evidence of at present in Belarus. Coronavirus aside, incumbent President Lukashenko won the recent election by a large margin, but independent opinion polls before campaigning began suggested that he only had around 3% of popular support. Many people are skeptical of the presidential election result, to say the least. Dissatisfaction with the result has been widespread, with activists engaging in unprecedented unrest on the streets of Minsk and elsewhere in recent days. The protests, increasingly vocal opposition, and an apparent widespread disregard for voluntary social distancing as a means to contain the health threat mean that while restrictions are almost certainly not on the agenda, incremental normalization is very unlikely. In short, Belarus appears to be a classic case of business first. Indicators-wise, with a clear intention to resist restrictions in any eventuality, case data is less useful in Belarus than elsewhere. That said, if the protests escalate, it's possible that Lukashenko could impose mass restrictions on activity under the cover of coronavirus. With the current unrest and apparent dissatisfaction with the regime, it could indicate a move toward a no normalization scenario. Otherwise, we're primarily looking for signs that public sentiment is calming. It might be that protesters have shot their bolt, they accept their loss, particularly following the flight of the primary opposition candidate from the country, and settle down in the short term. This is probably what Lukashenko is hoping, and it fits the pattern of previous bouts of election-related unrest. It might be that the internal security forces, of which Belarus is amply provided, are able to contain or intimidate the protesters to such an extent that the effects of the negative public sentiment are contained. Any indication that public sentiment is improving, be it a decrease in the number of protests, acceptance of the election result by activist leaders, any indication could suggest a marginal move toward incremental normalization. To sum up, I'll give a general outlook of the wider region. Former Soviet countries typically have a good baseline health capacity, and they went into the pandemic with widespread state-funded healthcare. In many cases, this has helped bolster public sentiment and helped countries manage the caseload. However, medical care is underfunded, and weaker economies in the region have encountered problems with upscaling medical infrastructure to meet the demands of the pandemic. As the pandemic has spread, this means that health services are more vulnerable to being overwhelmed than elsewhere in Europe. With the exception of Russia, you can add to this concerns over a lack of effective testing and tracing. This means that reliable case data is just not available to the people making decisions around restrictions, which increases the possibility that any implementation, maintenance, or relaxation of measures is not the ideal way of achieving incremental normalization. It also complicates the task of using restrictions in a targeted manner to control local outbreaks or protect vulnerable sectors without impacting the wider economy. This increases the possibility that the only restrictive tool in the box is indiscriminate. Hence, we've seen the nationwide reintroduction of measures in Kazakhstan and also in Uzbekistan. Compare that to some with more available case data, Germany, for example, where we're seeing highly targeted lockdowns of some areas, with most of the country continuing unfettered. Nevertheless, weak economic data also means that authorities are very reluctant to maintain mass restrictions, with the ability of many regional governments to manipulate public opinion through control of the media, for example, as well as their ability to limit the impact of public opinion through strong state security forces, means that public sentiment is less of an issue. Authorities can typically weather any criticism, and governments are far more likely to prioritize economic need than public sentiment. Business first, therefore, appears to be the dominant scenario throughout the region in the medium term. Thank you.